Hey y'all, this is Dr. Tasha, and I am back with a Monday medical moment. I get a lot of questions. Well, not questions. I get a lot of complaints. Oh, I have a UTI. I get recurrent UTIs. I get recurrent UTIs. I got pelvic pain. I have this. I have that. And my first question is always, what makes you think it's a UTI? Oh, because they said it was. Who is they? Who is they? And I'm always like, well, how did they diagnose you? Were you tested? Did they send your urine off for culture? Did they find bacteria in your urine? Did they treat the bacteria? Or did they just treat your symptoms, right? In my career, I treat this particular condition called interstitial cystitis. And in my career, if I'm gonna be honest, I have probably saved so many women from hysterectomy. And even issues with marriages and just long-term pain. And I want to talk today about interstitial cystitis because a lot of you are probably suffering from it and have never even heard of it, okay? So interstitial cystitis is very, very interesting because first and foremost, let me tell you about the symptoms before I actually tell you about the disease itself or the situation itself. So it can seem like frequent urination, painful urination. You go to pee and only a little bit of urine comes out. It feels like pelvic pain. It even feels like pelvic pressure. It feels like pain during intercourse, but it's really pain during intercourse, but the pain is worse after intercourse. It can even radiate to the back sometimes. So a lot of times people feel these symptoms and boom, they correlate it to having a urinary tract infection. You go to the doctor, you tell them the symptoms, they collect your urine, they give you an antibiotic, the culture comes back, you never hear anything because they're like, oh, there was nothing growing out, but she already has an antibiotic, so she'll be fine. But at the same time, your symptoms keep coming back and they keep coming back and they keep coming back. And you're like, okay, I'm having sex. It's a little bit uncomfortable when I'm having sex. And then after sex is really, really uncomfortable. And then God only knows what story you get from there. And interestingly enough, I had a woman who had a hysterectomy. And she's actually why I really started testing and inquiring and kind of treating the condition. And she's like, I had a hysterectomy because I had heavy bleeding, which again, you can see with interstitial cystitis as well. She's like, I had heavy bleeding with my periods and I had pelvic pain. I had pain with intercourse all the time. She's like, well, I'm not bleeding anymore because I had a hysterectomy, but I still have the same symptoms. And so obviously I'm like, okay, so we went in and I checked for everything. Obviously I checked for infection because common things happen commonly. She did not have an infection. So I said, okay, let me test you for interstitial cystitis. And she had it. Within a week on the medication, her pain was gone. And the total treatment time is 90 days. And she would have some flares every now and again, but for the most part, this lady's life was back to normal. And how many other women have, excuse me, girl, that was my other line. Anyway, so, how many other women could I have saved? Did I save and could I have saved from this situation? So let's talk a little bit about interstitial cystitis. Again, I said the symptoms are going to be painful urination, sometimes difficulty urinating, only a little bit of urine comes out with urinary frequency, constant urge. Sometimes up to 50 or 60 times a day, constant urge to urinate, but feeling like you can't really empty your bladder, pelvic pain, pain with intercourse, pain after intercourse. It can even be associated with heavy menstrual bleeding. Interstitial cystitis is sometimes seen, it kind of goes along sometimes with endometriosis, fibromyalgia, irritable bowel syndrome. So not really sure. We're not really sure why some people get it, where it comes from, how you get it. We don't really know, but we know what it is. So y'all know I'm visual. Y'all know I'm visual. So let me give you a visual of what interstitial cystitis kind of looks like. So imagine, your kid runs and they scrape their knee and the knee is like kind of like a strawberry on the knee. Is red and it's a blade. It's not bleeding, but it's like red and it's abrasive. What we think is with interstitial cystitis, for whatever reason, the lining of the bladder does that. And it gets like very sensitive and very inflamed. And so when urine hits it, it hurts, it burns, nerve fibers and sensations go all over the place. And reason being, as far as pain with intercourse, people don't realize that your vagina is like a vault. It's like a tunnel. right? But your bladder sits right on top of that tunnel. So with intercourse and the friction, and you're shaking that urine up on that inflamed bladder, horrible. But then when intercourse is actually over and everything settles down, those nerve fibers are just going bananas at that point. And that's why oftentimes it's actually worse after intercourse. We don't know why you get it, but we know what worsens it. And diet can worsen it. So like tomatoes, all the good stuff, tomatoes, spicy foods, peppermint, alcohol, cigarettes, all of that worsens it. And also, not drinking water. Let's be clear on that. Stress can also do it. Again, we don't know really why people get it. We know what it is, but we don't know why. But it has some association with stress and anxiety worsening it as well. Okay, so you say, all right, well, I have these symptoms. What if I have IC? What if nobody's ever tested me for this and I hate it? But as a male, males get it, but women get it 10 times more than males. So you're going to more commonly see a female with it than a male. For females, I test for it, but y'all know I'm different than the rest. But urogynecologists test for it in females, and regular urologists test for it in males, all right? And the test is generally going to be, and it's a multifactorial test, and that, yes, we check to make sure you don't have any UTIs. And for me, I do something called a potassium sensitivity test. And basically I take a pediatric catheter, because ain't nobody got time for no regular catheter, honey. I take a pediatric catheter and I put it into the bladder, and I put a couple of different solutions in. And interestingly enough, that same sensation you feel, that discomfort you feel, that having to pee real bad, or that pain that you feel, that is what you'll feel when the solution goes in. So you're like, well, damn, okay, I'm gonna take a test and it's gonna make me feel bad. Yes. But at the end of the test, we have what we call a rescue solution, and we instill that rescue solution, and it takes the pain away. But that is how we know, and that is how you know. So it's a very interactive test. Nobody can tell you, oh yeah, you got IC. No, you'll be able to tell, oh yeah, this makes me feel bad, or this, yeah. So you'll be able to tell whether it's a positive or negative test. And then you get treatment. The treatment, unfortunately, is 3 times a day. So it's like 1 pill 3 times a day. After a week, you feel like 80% better. After like 2 weeks, the pain is gone. But the total treatment time is like 9 months, all right? Now, if you go to a urogynecologist, honey, they want to stick a camera in the bladder and do biopsies. Girl, they do all that. But I get my answer after I do the potassium sensitivity test. If I truly have a suspicion that you have it, but the potassium sensitivity test is negative, then I will send you off to a specialist just to make sure we're not missing anything. But I guess the case in point is, don't always assume. And I hate this in medicine, because oftentimes we have tunnel vision. If we're not looking for a particular thing, we'll miss it. Just like when you go into you go to the ER and you're like, I have pain in my belly, and they do an ultrasound, like, oh, you got a cyst on your ovary. Well, unless that cyst is really big, you should have a cyst on your ovary, because you ovulate every month. And so they find out it'd be a little cyst, and they're like, oh, the cyst on the ovary, that's why you got a pain, go to your gynecologist. But that's what you see, but you're not looking for you're not saying, okay, pelvic pain, let me evaluate this patient fully for pelvic pain. You just like, oh, you got pelvic pain, bam, there's a cause of it. Oh, I'm bleeding like a pig. Oh, you got fibroids, and it'd be like a 2-centimeter fibroid. That ain't making cysts bleed like that. Like, drives me crazy with medicine. But anyway, so with interstitial cystitis, unfortunately, it really has to be one of those things that, 1, you're aware of what it is, 2, you know what it looks like, and 3, you know how to test for it, but then you also know how to treat it. And again, primary cares are definitely not going to know. Most gynecologists are definitely not going to know, and are not going to check for it. And you may just be reduced to seeing a specialist, which is a urogynecologist, or a male version of that, which would be a urologist. Okay, so I just want you guys to not be frustrated if you're on the barrel wheel of UTI. This is giving me a UTI. You're trying all these, little gimmicky stuffs, and I drink cranberry juice every day, and I don't have anything against cranberry juice. Let me be very clear, but the amount of cranberry juice that you would have to drink in order to positively affect something that's going on in your bladder or your kidneys, and even if it's IC, it's not going to have an effect on that, is so much that is it really beneficial to do it? I don't know. I judge not. But at the end of the day, if this sounds like something that you may be suffering from and nobody's really been giving you any answers, you have these symptoms, nobody can find any infection, and they're kind of just looking at you like you crazy, and you like, no, I'm not crazy. This is really happening to me. And like, oh, maybe you just have a small bladder. I don't know what that really means, but okay. But maybe, just maybe, you get online, learn a little bit about interstitial cystitis, read about it, so you can go to your doctor and say, hey, I think I have interstitial cystitis. Have you ever heard of this? Can you please send me to a specialist so that I can be evaluated for it, because I'm tired of living this life. And that is a perfectly reasonable thing to do. All right. So I hope this blessed somebody. I hope you hear me. And I hope that, you know, somebody sees themselves in this and they get off of that gerbil wheel of constant antibiotics and symptoms and antibiotic and symptoms and blah, 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 without any real relief. It might not be a UTI, sis. It could be IC. All right, y'all. Bye.